for several more students. So let's just hang tight for a little bit. If you tried to open your quiz before now, you're going to have to refresh because it doesn't open till the top of the class hour, which is 1 o'clock. So it should be open now. But don't start it yet. So how is everybody doing for Tuesday of week 6? We're right in the thick of it now, aren't we? We are right in the thick of it. Midterm week. Midterm week. Let's just wait another minute or so and see if we can get the rest of the students in here. Still missing a few. Okay, couple of updates. Well, let me tell you how today's going to go. We are going to do quiz 4 at the beginning of class, review that quiz. Then we'll go through some of the content of our concepts today, which is week 6, occupational health, environmental health, barriers to learning, reinforcing health education. After that, we will do a case study. It's a health education case study. Like week 3, we'll break out into 3 breakout rooms where there's 3 questions and each room will answer a question. Okay.
I'm sorry. Ashley says she's in the waiting room and she can't get in.
Okay,
Maya in the waiting room too.
Okay, I don't have anybody in the waiting room right now. Um, Sabrina, I just saw your message in the chat. Is that for after class?
No, it was for now.
Well,
it's okay. It's all right. Don't worry about it.
Okay. Yeah, I don't have anybody in the, just so you know, if your teammates are texting you, I don't have anybody in the waiting room at the moment. I just checked. So we'll have to wait. You could tell them to try again. Okay. A couple things, group projects. Everybody has their group assignments. Hopefully you are working on your, oh, I have 6 people now in the waiting room. Who are those people? All right. I have Maya. I have Steffi Joseph. Reese. Jeanette. Iris. And Ashley. Okay, let's get everybody in. Okay.
Professor Marvel?
Yes.
I do apologize, but once the quiz is done, I do have to run and go get my child. Something happened at school.
Okay. And
so I will be back on the Zoom, but I just have to go get him.
Okay. Who's speaking?
Okay.
I'm not sure who's speaking.
Kathy.
Kathy. Where's Kathy? Okay, there you are. Okay. I'll make note of that.
Okay. I'm gonna be back.
Okay.
I just have to go get him.
Okay. All right.
Okay.
Sounds good. Thank you.
Thank you.
There's still a few people I can't see on camera. Alan, I can't see you. Sienna, I can't see you. I can just see your forehead. Ashley, I can't see you. Jasmine, I can't see you. So I need to see everybody's faces. Okay, Sienna, that's a little bit better. Jasmine, I can't see you. There's Alan. Okay. Okay, so I just went through for the group. We're going to do quiz 4. We are going to go through quiz 4 and then we'll go through content from all the concepts this week, the 4 concepts, and then we'll do a case study. Okay. In the meantime, a couple of housekeeping. Don't start the quiz yet. If you tried to open the quiz before 1 o'clock, it won't open. It won't open until 1, so you'll need to refresh. Don't start just yet. Group projects, you should be working on your group projects. They're due at the end of next week, so a week from Sunday. I haven't heard from any groups that they're having any issues. If you're having any issues with people not participating or not responding, just let me know and I can give a gentle nudge as well. But I assume everybody's working on their group projects. This is exam 2 review week. We did have an exam review this morning. I don't believe anybody was there. There's still 2 more to go to. Friday, I have one after my class. I think it's at 6 p.m. Eastern. And then Professor Kershaw has her Sunday evening. And you have the master schedule for times. Okay, so if you could try and get to one of those, that'd be great. You will get the recordings. Okay. So at least you'll be able to review the recordings in case you can't get there. Okay. The other thing that if you read your week 6 announcement all the way to the end, you will have noticed that homework grades have been turned on. Okay, so homework grades are turned on for this week and next week in preparation for week 8, which is drop week. Okay. So you'll have your homework grades for about a week and a half, and you can see, is your homework positively affecting your grade or negatively affecting your grade? Okay, so that's why the homework grades are turned on for now. Okay, does anybody have any questions before we get started with the quiz? Okay, so let's get everybody on mute. I'm going to put the access code in the chat, which is my last name. So go ahead and feel free to get started on the quiz. Make sure you submit it when you're done before you go off camera. And it is 1:08. So 15 minutes. Let's come back at 1:25. Let's come back at 1:30. 12:10, 12:25. Let's come back around 1:25, 1:30, and then we'll get going with the rest of the class. How does that sound? Okay, I'm going to mute myself now. If anybody has any questions in the next 20 minutes, please put them in the chat. Don't come off mute. I don't want any interruptions for other students. All righty? Okay, go ahead and get started. Hey, it looks like everybody's finished. If you could start coming back on camera. How'd you do? Are those concept recording videos helpful at the beginning of each week? Anyone?
Oh, I'm sorry. You asked a
Okay.
question?
No, my question was, this term we tried something new and sending out the concept recordings, the short recordings, the introduction to the concepts with each weekly announcement. Have those been helpful in helping you prepare for quizzes?
Not really.
No?
Concept,
Okay.
Professor, no.
All right. Anybody else have any feedback about the concept recordings?
Yeah, helpful.
Okay, Jasmine, Brianna, Chanel, Trenya, and Jade, if you could come back on camera.
Brianna's in the bathroom.
Okay.
Here,
Chanel,
did you say? Didn't you say 1:30 here? Okay.
I said between 1:25 and 1:30, and it's 1:28.
Okay.
Okay, so let's go ahead and review the quiz. Can everybody see my screen? Can anyone see my screen?
Yes.
Thank you. Thank you. Okay, the first couple of questions are a refresher about vulnerable populations. Which statement is not true? Hopefully you picked up on that word not. So we're looking for something that is incorrect. And obviously C is the incorrect answer because vulnerable populations have a higher mortality rate. Correct?
Correct.
Okay. We know that A is true, right? Vulnerable populations often have poor health outcomes. We also know that B is true. Vulnerable populations have higher rates of communicable diseases. And we know that vulnerable populations are exposed to higher levels of crime and violence. So this rationale, let me ask another question. Are you guys enjoying having the rationales after the quiz questions?
Yeah.
So one of the things that I've encouraged before, and I would encourage as you start to prepare for exam 2 with weeks 4, 5, and 6 content, you have 2 quizzes that go along with exam 2. That is last week and this week. So I would encourage you to use these rationales about your concepts as an additional resource in preparing for the exam. Okay, because a lot of these rationales I take from your book reading. Okay, so for example, the rationale here in question 1 about vulnerable populations, this is from your book. We know that vulnerable populations often have poor health outcomes compared to people, compared to other people in terms of morbidity and mortality. Right? These groups of vulnerable populations have a higher prevalence of chronic illnesses such as hypertension, high levels of communicable diseases, including TB, hepatitis, STDs, and there's also a higher incidence of upper respiratory infections, including influenza. Right? They also have higher mortality rates in the general population because of factors such as poor living conditions. And poor living conditions can affect a lot in their environment. Poor health, or poor diet, poor health status, maybe that's due to access. Maybe that's due to not prioritizing primary care. We also know that this population is at higher risk for crime and violence, including domestic violence in their environments. So that rationale is a really good review about the vulnerabilities of vulnerable populations. We talked about this this question a little bit last week when we introduced the LGBTQ population. So which of the following should be the initial? All right, that's an important word, initial. So the first, which of the following should be the first consideration made by the nurse who's working with vulnerable populations? Everybody understand why B is correct, or why is B correct?
Yes.
Well, tell me why. Why is it important that B be the first consideration?
Well, understanding people feel, I mean, these are different individuals, and it's, I mean, they're I want to say the word sensitive, but you know, it's sensitive. So therefore, addressing them, I mean, you don't have to be necessarily for it, but you're a nurse, so you give care. So understanding, and it's cultural sensitivity.
Exactly. Excellent. Excellent. Yep. In order for us to work towards our cultural competence, right? Like Tamisha said, whether we agree or not agree, right? We do have to reflect on our own personal feelings when working with the members of vulnerable populations, right? Do we have any judgments? Do we have any biases? Do we have any prejudices? Do we have any stereotypes that we need to address, right? Because we have to be able to address those prior to working with these populations. So as Tamisha said, we can provide culturally sensitive, culturally knowledgeable, and culturally competent care, right? And this question's a good example of reading a question and saying, well, all of these answers could be correct, right? When we're working with LGBTQ population, we should have an understanding of same-sex marriage laws within the state, right? When we're working with the homeless population, we should have an understanding of the family structure within working with homeless families. And again, working with LGBTQ, we should have an idea, or we should understand when we do our assessment of gender identity and sexual orientation in a safe environment. So those are all correct answers. But the question was asking, what should be the initial consideration? All right. So if you got to this question, and even if you get to a question like this on the exam, and you see that one or more answers could be correct, but it's not a select all that apply, you got to look back at the question and see if there was an important word or phrase that you missed. Okay, so we know that the foundation for a good nurse-client relationship has to begin with the nurse's understanding and self-awareness of our own beliefs, our own value, our biases, our own feelings, our own values. Right? So that's why B is correct. It's not that the others are not correct, but B is the initial consideration. Okay. So Nurse Sarah is discussing discharge with new nurses during orientation. Which statement by one of the new nurses will Sarah need to correct? What kind of question is this? Is this a positively framed question or a negatively framed question?
Negative.
Right. So we're looking for something that one of the new nurses say that's incorrect or requires her to have more teaching or education. And so do we all understand why D is the right answer? Right? Because discharge planning does not begin once a social worker receives instructions to set up home health, right? When does discharge planning begin?
On admission.
On admission, right? So discharge planning requires looking ahead to meet the patient's ongoing needs at home. So in preparation for discharge. It's a process that begins at the time of admission. We have to be assessing what kind of special needs the client may need, whether maybe it's physical therapy, occupational therapy, speech, medical home equipment. All right. We need to be able to identify when it's appropriate to do teaching with our clients. We need to provide learning opportunities for these clients that are brief and focused on the patient going home. If there's a lot of services or resources they're going to need when they go home, we need to be able to break that up into chunks, right? So a patient is this is question 4, I believe. Patient is newly diagnosed with diabetes. The patient will need insulin injections. The patient is unaware of how to administer injections. Which reply by the nurse will gain more information from the patient? Do we all understand why D is correct? It's really kind of the same rationale as we talked about in a couple of questions earlier of what are our feelings? Acknowledge our feelings. How are we feeling about certain things? Well, we would apply the same to the client, right? In order for us to establish a teaching plan or establish any objectives or goals, we do have to understand how the client is feeling, right? Maybe they lack self-confidence. Maybe they lack literacy skills. Maybe they're afraid. Maybe they're confident. Maybe they're motivated. Maybe they're not motivated. So by asking them how they feel about this that's your assessment part. That gives us an understanding of how our teaching plan is going to be developed. All right. So let's look at the rationale here. Assessing the patient's readiness to learn is an important part of developing a plan for teaching. And that's what we're doing by asking that question. How do you feel about things? Encouraging them to talk about their feelings, concerns, anxiety, and goals helps us as nurses develop that plan. We know that motivation plays a large role in effective learning, right? What we're trying to motivate clients to do is be motivated to learn so that they can try their best to return to independence, right? Independence in the comfort of their own home. Okay. Also important to be working with clients to show them the advantages of learning what they need to know. You know, this is a serious diagnosis. Your diabetes is a serious diagnosis. You will require insulin. Here's why that's important, right? So it's up to us to educate them on the importance of embracing the learning we're doing with them. Okay. Any questions about that question? Okay, Sam is in the clinic today. He's a high school graduate. There are several pages of discharge instructions. The nurse can assess his ability to read and comprehend written instructions by doing which of the following? Does everybody understand why B is the correct answer? We can have Sam read those discharge instructions and discuss what has been read to determine comprehension. Okay, A is incorrect. Okay, graduation from this was in your readings. Graduation from high school does not guarantee reading comprehension. Okay, so A is incorrect. C, asking Sam, when did you graduate from high school? That doesn't matter. So that's not a correct answer. And then asking Sam, are you able to read? What's the problem with that question?
That's a closed-ending question.
Okay. Keep going. What if he says yes? And he really can't?
It does not
He could
guarantee
be
that
lying.
you will comprehend.
Say that again?
Reading does not guarantee that you understand or you comprehend something.
Exactly. Exactly. Let's read the rationale first and I'll explain a little bit further. Evaluating the effectiveness of patient education is critical to the success of the process and whatever plan you have developed. It involves giving and obtaining feedback from the patient regarding what was taught, and then using the feedback to determine whether effective learning has in fact taken place. A return demonstration of a skill is one way of evaluating patient learning. You can point out what they did correctly. You can also make suggestions about what they didn't do correctly and how to fix that. Right? When a patient is learning information rather than a skill, let's say you're going through discharge instructions, written discharge instructions, we can ask questions to obtain feedback about retention and comprehension of the material taught. Obviously, we can allow the patient, give the patient some time to think about and talk through their answers, right? It's always helpful to give patients any printed materials. Okay. So one of the things we'll talk about when we talk about barriers to learning, and this question could apply to that, is a few of the barriers to patient education is low literacy and language barriers. Right? We may be working with a client that has low literacy skills. And I don't say that in a condescending way. There's a lot of clients that have low literacy skills, which means they may not understand what you're saying and may not be able to follow through, let's say, with discharge instructions. We as nurses have to be able to evaluate the comprehension level. Otherwise, it makes no sense to go through discharge instructions. We'll talk about literacy a little bit later as well. So this next question addresses low literacy. Lisa knows that low literacy is a learner-related barrier. Which of the following statements by the client indicates the client is experiencing a learner-related barrier to new information? Select all that apply. So B and C are red flag statements. All right, I don't like to read. I don't like to read. Just tell me what I need to know. What does that really mean? Maybe they can't read. Right? I'll figure it out. Just tell me what's important. Maybe they don't understand. All right, so before beginning to teach, you need to assess what factors might be interfering with the patient's ability to learn. Right? Some other related barriers, conditions that affect learning. Maybe there's a visual issue. Maybe there's a hearing issue. Maybe there's a motor function issue. Maybe they have low literacy or they're illiterate, can't read. Maybe they have impaired cognition. Right? Very often when we're teaching, patients do express lack of self-confidence. Maybe they'll say, I'll never be able to do that. I used to hear this all the time in the schools when I'd be working with kids that had newly diabetes diagnoses, right? And working with them to teach them how to check their blood sugar, how to recognize signs and symptoms of hypoglycemia, hyperglycemia. Maybe they switch from an injection to a pump, teaching them how to use their pump. There's a lot of anxiety and ambivalence towards learning these new skills. Okay, so we have to be able to explore these feelings, right? Of what self-esteem issues might be in the way. All right, obviously praise and encouragement from us, the teachers, are going to go a whole lot further than negativity. Does that make sense? Okay. This is an introduction to occupational nursing. Okay, the nurse may conduct an assessment of the workplace. That's what occupational nursing is. It's nurses assigned to the workplace. Nurses may conduct an assessment of the workplace itself, which is known as a worksite walkthrough or a worksite assessment. Direct observation from these nurses walking through work sites allows the nurse to learn what? Okay, and all 4 answers are correct. This is what occupational nurses do. And we'll talk about that more in just a minute. They have to be familiar with work processes. What is it? Is it a bank? Is it a fast food restaurant? Is it a hospital? Is it a power plant? Is it a car manufacturing plant? Every work site has rules and guidelines and laws that need to be followed. Okay, so this is part of the occupational nurse's job, to understand work processes and materials. What are the job descriptions of various employees in whatever workplace it is? What are the presence of actual or potential hazards in that particular workplace? And do the employees practice safely in their job? Okay, so that's the rationale is exactly that, those 4 answers. And we'll talk about that in a little more detail here in a minute. Okay, Mary the nurse knows that there is no safe occupation. All right, one of the regular scheduled primary interventions that Mary will implement. What's primary here? Do we understand why A is primary? Providing safety education as to prevent accidents or injuries, right? We know that's primary. What is B?
Tertiary.
Why? Why is B tertiary?
Because it's treatment.
Yes.
Treatment. They're taking medication for something, right? What is C?
Secondary.
Secondary.
Secondary screening.
Secondary.
Yeah.
Yeah.
And what's D?
Tertiary.
Right. So they're requiring surgery. So in this rationale I gave you from the book, a screenshot of some primary, secondary, and tertiary examples related to occupational health. All right. Teaching coping mechanisms, providing healthy diet education and safety education, providing education on the use of proper lifting techniques or using protective equipment. That's all primary. Prevention. Secondary. Let's say you work in a large, noisy plant. Well, maybe the occupational nurse is doing screening for hearing loss. Are people using their hearing protective gear properly? Maybe you're doing blood pressure screenings. Screening for stress and burnout, really important in the workplace. And then tertiary, let's say somebody's injured on the job. That occupational nurse looks at when they're prepared to come back to work. Do they have to be in a limited duty position? Can they return back to their full job with all the requirements? Or it's all based on an injury. So tertiary is evaluating how the employee returns to work, right? Maybe providing illness or injury specific education. Let's say they went out and had carpal tunnel surgery, or they've been diagnosed with carpal tunnel syndrome. That occupational nurse will work with that employee to make sure they're wearing their wrist braces correctly, make sure they're wearing their wrist braces. Right? Let's say somebody goes out with a back injury or somebody's had back surgery, and part of their return to work instructions from the physician say they need to be wearing a back brace. That occupational nurse is responsible for making sure they're wearing it correctly per the return to work guidelines. Okay. Which step of the ethical decision-making process is identifying an ethical issue? Well, we can't go through the ethical decision-making process until we've identified an issue, correct? It's kind of like teaching. We can't really develop a teaching program for a group of people until we do an assessment of what the needs are, right? So to go through ethical decision-making discussions, we have to have an issue that we're talking about. And then number 10, environmental health question. The home health nurse works in a community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic is a priority? Okay, so if you read about environmental health, right, high rates of chronic complex illnesses associated with neurological disorders can be a factor of living in an environment that has several manufacturing plants near the community's river. Okay, so let's look at this rationale because it starts to introduce environmental health. All right, so assessing a patient for environmental health risks requires asking a lot of questions. Okay, where do they live? Where do they work? Where they go to school, or where they send their children to school? What's their diet? Okay. A windshield survey of driving through the community, looking through your windshield, whether you're in your car, a bus, on a bicycle, taking a walk. A windshield survey can give you a lot of information about the environment. Okay, what kind of environment do people live in? Is it near manufacturing plants? Is it near waste sites? Is it near a transportation hub? Is it a community that has a lot of crime and violence? Is it a dirty community? Is it a clean community? Okay, is it an agricultural or rural community that sprays a lot of pesticides? A lot of risks in the environment. We'll talk about that. I want to jump to your reading and review this as an introduction. This was in your module. So we talk about today's concepts: occupational health, environmental health, and then barriers to learning and reinforcing education. I want to review a little bit of this reading from your that was embedded in your module because it gives a good introduction to occupational environmental health. Okay. Occupational environmental health nursing is a specialty practice that provides and delivers health and safety programs and services to workers, worker populations, and community groups. All right, some of the primary roles of these nurses in occupational environmental health focuses on restoration of health, prevention of illness and injury, protection from work-related and environmental hazards. All right. This is a pretty incredible fact, right? Right here. For employee health costs, okay, cost businesses upwards of $1 trillion a year annually, right? Corporations and large companies, hospitals, they look to occupational and environmental nurses to maximize productivity in the workplace, right? Trying to reduce disability claims, have fewer on-the-job injuries, improved absenteeism rates. I mean, think about it. We all know somebody, probably know somebody that we worked with that's either been injured on the job or was out sick or has an illness or a family member's illness that they had to take leave or they had to be away from the job, right? The common term is workers' comp. Everybody heard of workers' comp? That's what happens. All right. So occupational and environmental nurses' jobs are very important. There's a lot of occupational and environmental nurses that work with big insurance companies. Okay. Some of the roles of occupational and environmental nurses. All right. We can be clinicians. We can be educators. We can be resource managers to provide employees resources to whatever's going on. Case management has become very important in the field of occupational and environmental nurses today. Case management, we'll talk about that in a few weeks, but essentially it's the coordinator of care. That's what a case manager does, coordinator of care. So if you have somebody that's been hurt on the job, that occupational nurse is going to be working with the insurance company, going to be working with human resources for leaves, going to be working with the employee to see what the progress is, going to be working with the physician to find out what can they do when they come back to work, when can they come back to work, what can and can they not do. And so that's what a case manager role is as an occupational nurse. And remember, workplaces are not all about work injuries or illnesses. There's a lot of mental health issues that go on in our country every day. A lot of people come to work with stressors, with anxiety, with mental health diagnoses, maybe substance abuse, alcohol abuse, right? And if you look at the statistics of workplace violence over the last decade, they've increased dramatically, right? So along with working with workers about maybe work-related illness or injuries, that occupational health nurse is also working with employees that, like I said, may have substance abuse, psychosocial needs. Maybe they have wellness, health promotion concerns. Maybe they have burnout. Maybe they're having a hard time managing work and life balance. A lot of big corporations, big employers have what we call EAPs. So everybody heard of EAPs, employee assistance programs, right? That these occupational nurses can give resources to employees to tap into an employee assistance program, right? For therapy or follow-up or group education. Okay. The other thing occupational environmental nurses do is primary prevention things. All right. Health promotion, risk reduction. Right. They may develop programs that support positive lifestyle changes. Right. So as to help the individual employees lower their risks for disease and injury. Okay. Examples, education about work, family, personal health, psychosocial concerns, maybe immunizations for kids, smoking cessation, exercise and fitness programs, nutritional and weight control, stress management, monitoring of chronic diseases. Okay. So that occupational nurse also focuses on primary prevention. It's not just tertiary with illness and injury. They do all three: primary, secondary, and tertiary. And then there's legal and regulatory compliance issues that go along with workplace laws and guidelines. Okay, everybody's heard of OSHA, right? Occupational Safety and Health Administration. Okay. OSHA, I wouldn't say is the enforcer, but OSHA monitors the compliance of every workplace. Like I said, whether it's a fast food restaurant, whether it's a hospital, whether it's a rehabilitation facility, whether it's a gym, whether it's a recreation center, all work areas are subject to laws and rules and guidelines for safe practices for employees. Okay. HIPAA falls under legal and regulatory compliance. FMLA, family leave, falls under that. Let's say you work in a hospital and there was an unexplained death in the OR. OSHA will come in and look at what happened. Did employees follow guidelines? What was missed? What happened? All right, let's say you have falls, an unusual high rate of falls with clients. OSHA will come in and look at why is that happening? Are we following the guidelines that were set up for patient safety and employee safety? Okay. And then worker and workplace hazard detection. And this goes back to the question of what should the occupational nurse know? Okay. They need to know what risks are in each person's job description. Think about being an occupational nurse in a big hospital. You have to be aware of everybody's job description, right? The job description of a OR tech is going to look different than a job description of somebody who works in transport or somebody who works in food services or environmental services, right? They all have different parts of a job description. Their role is to make sure employees understand their job description and can provide whatever services they're providing in a safe and effective environment. Does that make sense? Everybody see this? This was the PowerPoint sent to you guys this week. Let's see what we still need to cover. So this was occupational health. We talked about, talked about workplace assessments from the occupational environmental nurse, learning about the processes of what the business is, hospital, fast food, recreation center. What is the business? What does it entail? Who works there? What are their job descriptions? What are the training requirements in order for them to do their job safely, right? What are the materials stored in these places? Are they safely stored? What if there's a spill? Do people know what to do? What are the job requirements? Occupational nurse, potential hazards of the job. They have to understand that. They do observations of work practices of employees. They also observe effectiveness and safety education and equipment. And we talked about nurses seeing various injuries and diseases acquired from employment. Every single industry has serious hazards related to work. Doesn't matter where you work, there are risks. And then knowing that no work is completely risk-free. We know that, right? We talked about the roles. Educators, case managers, counseling, crisis intervention. That would be for tertiary, health promotion, risk reduction, primary, legal and regulatory compliance, and being able to know what employees are exposed to. This was in your rationale. I'm not going to go through this. This was the rationale for one of your quiz questions. Environmental health, very similar to occupational health, but let's talk about environmental health as a separate entity. Think about the environment you live in. Okay. Some of the most common environmental risks are air pollution, water contamination, food contamination, soil contamination. Think about where you live. Think about your own zip code where you live now. How aware are you of environmental risks? And what is in your environment that is risky? Do you live near a power plant? Do you live near rivers or streams or water or potential water contamination? Do you live near big transportation hubs that provide have a lot of air pollution? Do you live near busy roads, busy highways? I live within a half a mile of a big thoroughfare that goes from the east to the west coast, I-70, and I get these I live half a mile. I get these trucks, big 18-wheelers, minute after minute after minute coming out of the mountains in Colorado. Coming out of the mountains, I can smell their brakes. I can hear their brakes. You can just, it's amazing. It's amazing when you pay attention, the air pollution that's in my area. Okay. Do you live near railroads for a potential railroad accident or a chemical spill? Do you live in a community that is dirty? There's trash everywhere. Do you live in a community that is an industrial community with lots of plants, lots of noise? How about agricultural? You live in the agricultural areas where there may be pesticides being sprayed from above. Right? Do you live in a community that is older housing? May have a lot of potential for lead-based exposure, lead paint. Right? Crowded living conditions. There's a community that has a lot of people living in close quarters and all those other risks that go along with that. And then think about your own home, your own, wherever you live. Think about what you have around your home. Pesticides, herbicides, chemicals. All right, maybe stored under your kitchen sink, maybe stored out in the garage. And then think about food contamination. I'm kind of giving the whole spiel now, but think about food contamination. I don't know about you, but when I go to a restaurant or go through a fast food, I just assume that everybody's doing what they're supposed to be doing, right? They're preparing the food correctly. They're storing the food correctly at the right temperatures. They're cooking it the right way. They're washing their hands. But there's a lot of foodborne illnesses and outbreaks that happen, right? So environmental hazards, environmental risks are very, very common. It's estimated that environmental hazards are responsible for 1/2 of the total burden of disease. That's a lot. It's estimated that environmental hazards contribute to over 80% of communicable and non-communicable diseases. You know, kids are very vulnerable to environmental hazards. Okay, people living in poverty, very at risk for environmental hazards. We talked about a little bit about this in one of the questions, one of the rationales. So when you're doing your environmental assessment, whether you're interviewing an individual, a family, where do you live? Where do you work? What is your housing like? Do you live in older housing exposed to lead-based paint? What's your dietary history? You know, what if you live near a river or stream and you're fishing for your meals? Right? And there's high levels of mercury in that water. Pesticides, always a risk. Drinking water. How do we assess our drinking water is adequate? And same with air quality. Right? Why are kids more sensitive? Okay, kids are definitely more sensitive to environmental risks, and here's a few reasons why. The more risks they have, the more at risk they are to develop childhood cancers. Anybody ever saw the movie Erin Brockovich?
Yes, it's a really
Yes,
good
with the
movie.
water pollution.
Exactly. Erin Brockovich is a movie about an environmental disaster.
I'm sorry,
Where-
Professor.
Pardon me?
Sorry to cut you off. I just sent you a direct message. I have a little problem. I have to get up the Zoom meeting.
Okay, I don't check my chats. I don't check the chat messages during class because I have to get out,
Okay.
stop sharing. So I'll check it after class. Okay. That Erin Brockovich movie is about an environmental disaster. A company was contaminating water, and water was running downstream, And it affected this small community in Texas where kids were developing all these unusual cancers. That is environmental disasters is exactly what that movie is about. It's an excellent, excellent movie. So here's some other reasons you can have a look at that of why kids are more at risk. This is about food contamination. Okay.
Professor Marvel, can you go back to the previous slide, please? I have a question regarding the next one, please. Yes, water by body weight. Can you give more explanation about this one, please?
Water by body
Right.
body weight, meaning when they're developing, kids will have more water by body weight, so they are more at risk for, say, respiratory illnesses, retaining fluid. Does that help?
Yes, that's very
Okay.
helpful. Thank you.
Yep. All right, let's jump to patient education and barriers to learning. I want to cover this because I want to do the case study. Okay, we know that patient education is one of the most important roles as a nurse, right? We know that we use education for many reasons, okay? We promote health, we prevent illness, injury, we try and improve healthy behaviors. We try to enable patients and their families to take care of themselves and their health conditions. You know that education empowers, right? The more educated you are, the better decisions you will make. The more informed you are to make better decisions. It doesn't matter where we work, whatever role of nursing we are in, we are always educating in every role. We know health, we already talked about low literacy being an issue. The other thing we need to be aware of is over the course of our nursing career, we're going to be working with numerous other cultures and people we care for, right? So we need to be proactive in learning about different cultures. What are their attitudes? What are their beliefs? What are their practices? How can we incorporate all of that into the health plans when we're doing education? Okay, we also know that language might be a barrier. Okay, what's the best way to educate people that don't speak the primary language? Well, one of the things that we can do is provide information in their native language. When I was in the schools and we were at the beginning of the year doing all the big outreach for immunization compliance. Okay, why is it so important? What do you need? What are the intervals you need it? You can't come to school unless you have them. Do you want to do a personal exemption, religious exemption, medical exemption? We provided all that information to families that did not speak the primary language in their respective languages so they could understand it. Okay. There's 3 domains to learning. Okay, cognitive, affective, and psychomotor. We all possess all 3, but usually one is dominant. Okay. Cognitive, and you're going to get asked about this on the next exam. I want to make sure you understand that. Okay. And actually, when we're providing teaching to groups, we need to assume that some people are cognitive learners, some people are affective learners, some people are psychomotor learners, and be able to develop our learning to meet the needs of all. Okay, so cognitive learners, primary cognitive learners, that's your thinker. Okay, it's the thinking, it's the ability to hear or read information, understand it, memorize it, and then use that information to make decisions. That's the thinker. That's a cognitive learner. Affective is the feeling. Some people learn based on the thinking part of it, right? Maybe their attitudes, beliefs, feelings, values, that's going to affect their ability to learn. Have you ever sat in a mandatory in-service that you didn't believe in or didn't have the same opinion of, and you're probably less likely to learn, right? So what I'm trying to say is your attitudes and beliefs about certain things may affect your learning, right? And then your psychomotor learning is your hands-on. Okay, that's the kid you're trying to teach in the school that's a new diabetic. You're trying to teach them how to use their glucometer, how to use their insulin pump. They practice, we teach them, they practice, they return, demonstrate. That's your psychomotor. It's you gain confidence and competence by hands-on practice. And remember, when teaching as well, you may have people, you may have different age groups, you may have different genders, you may have people who are visually impaired or learn visually. You may have people that are auditorily impaired. All right, they may be motor impaired. That's one of the things about teaching. You have to be able to read the room. Who is your audience? And assess what the best learning needs are for the group. Okay? And if education doesn't address all three domains, meaning we have to be able to reach out and meet the needs of all three kinds of learners, your teaching's not going to be effective. All right, telling somebody to change without motivating them to do so or providing them with the skills necessary, it's not going to work. It's just simply not going to work. And the next slide explains that. Learning has not occurred until the behaviors change. You can teach and teach and teach and teach, right? But until the behavior is changed, it's not going to matter. Behavioral changes are hard. We understand that. We all tend to try and take the path of least resistance. Okay, does anybody work with somebody who your unit or your department is trying to implement a new way to do something? Because research has said, oh, we can do it better this way, right? Or studies have shown we can do it better this way. Does anybody work with anybody that will say, oh, no, it's okay. We've been doing it the same way for 30 years. We're okay. Does anybody work with people like that who are resistant to change? Yeah, it's hard. It's hard. Okay. All right. So let me, oh my gosh, I can't see anybody. Nobody's on camera. Hardly anybody's on camera. See, when I share my screen, I can only see 2 or 3 students. So I'm going to put, somebody needs to pull up in your group, needs to pull up from our week 6 announcement, the health education case study. Okay. I'm going to break you out into breakout groups for about 5 minutes. Room 1, answer question 1. This is just a case study that reinforces what we just talked about teaching. Room 2, answer question 2, and room 3, answer question 3. And we'll just be in a breakout room for 5 minutes or less, and then we will come back and go through each of the questions with each group. Okay? Does anybody have any questions about the content we just covered? Oop.
I can't find the questions that I'm looking in the information.
It's in your week 6 announcement. At the bottom, it says week 6 case study. Can anybody find it?
I found it. I found it.
All right. See you guys in a minute. Ashley, you gonna join your group? Shireen, join your group? Trenra, join your group? Iris? Iris isn't awake. Shireen, you gonna join your group? Miss Lewis, are you going to join your group? You have an invitation to join your group. Miss Lewis, can you hear me? Should I give you enough time? Okay. Okay. Let's have a look at the case study. All right. We all read what the case study's about. Okay. Room 1. Did you come up with answer C? And if so, why? Room 1? There were 9 students in room 1. I need somebody to answer.
Group 1, we got C.
And how did you come up with that?
We said that you have to identify the needs. Each child learns different, so you need to learn how do they learn.
That's right. We just talked about that. Right?
Yeah.
Look at the rationale here. Core public health principle is asking learners to participate in identifying whatever their needs are. You can't teach if you know what the needs are, right? All right, then education programs are designed to meet the needs of the problem that's been identified, right? I'll send along this instructor version of the case study when I send out the recording of the course today, so that you can have a look at the rationales, because it just reinforces the teaching we talked about today. Room 2. Did you come up with answer C? And if so, why?
C.
Yes,
Because
C.
you have to have your goals have to have that acronym SMART, specific, measurable, achievable, realistic, and timely, and that's C.
That's
C.
excellent. Good job, Jeanette. That's excellent. Excellent. Right. Remember that this rationale talks about the difference between objectives and goals. Right? Objectives are short-term criteria that are used as steps toward achieving those long-term goals. And that's exactly what C is. Within 2 weeks, each child will be able to demonstrate at least 2 exercises.
The teach back also.
Exactly. Exactly. And then room 3. This is kind of a funny question, but this is about question 3 is about educator-related barriers. All right, so what's the problem with Mr. Miller here, room 3?
First, he is not practicing what he is preaching. So
He's
setting a bad example.
Right.
He's definitely not practicing what he's preaching. Right,
So
horrible example.
Right. So we definitely thought A was an answer for sure.
Right. Well, think about it. I don't even have to read the rationale here. Think about it.
Mm-hmm.
As an educator, you have to be able to be credible to your audience, right?
Right.
Right. So lack of credibility, whether you don't know your material or whether you're not meeting the needs of the audience. We've talked a bit today about learner related barriers, but there's educator barriers as well. Right? And all 4 of these answers could be considered an educator barrier. Credibility, lack of knowledge, right? Lack of knowledge of how to work with kids, not be able to answer the questions. So, okay. So, questions about all the content we covered today. Occupational and environmental health are an extremely important part of community health, public health. You will be very much involved in that if you work in the community. Does anybody have any questions about the content we covered today? Okay, so I'll send you, when I send the recording later today, I'll also send you that case study with the answers and the rationales to be able to review. They have good information in those rationales. I hope you guys have a really good rest of the week. Try to get to some of the reviews if you can. You'll be getting the recordings. And here's the other thing. If at the end of preparing or during preparing for exam 2, you guys test on Tuesday, if you're running into problems with understanding any of the concepts from weeks 4, 5, and 6, got to reach out to me. Okay. And we'll schedule a tutoring session to go over what you're still struggling with. Okay. Prior to next Tuesday.
Professor Marvell, do you have some Kahoot we can practice?
Oh, yes. Professor Kershaw is working on, you have a 4 and 5 Kahoots, right?
Do we?
Yep. You have a 4 and 5. She's working on a week 6. So I'll remind her. I'll shoot her an email. Thank you. For a Kahoots for this week. But you do have a Kahoots that I posted last week for weeks 4 and 5.
Okay, thank you. I will check it out.
Welcome.
Again. Thank you.
So really good to see everybody today. Have a good rest of the week. If there's anything you need, please reach out. Okay. Please.
Don't forget, I'm waiting for you after class.
Mm-hmm.
Thank you. Have a good one.
All right. Have a good week.